Latinos have one of the lowest health insurance rates in the country. Our community felt the impact of this and other disparities during the COVID-19 pandemic. Latinos have been 3 times as likely to be infected than white people. We were 4.2 times more likely to be hospitalized. And our community experienced 20.5% of all US COVID-19 related deaths. In states like California, 39.2% of the population is Latino. However, we made up 56.2% of the COVID cases as of June 2021 and 48% of deaths. The pandemic has highlighted disparities that already existed between majority Latino communities versus nearby, wealthy, mostly white neighborhoods. An example of these divergent realities exists in 2 communities in Houston, Texas, Gulfton and Bel Air. The former has an almost 70% Latino population, with many families that clean hospitals, hotels, and houses. During the pandemic, their work placed them in high-risk environments. As of June 2020, Gulfton had more than 1,100 COVID cases, with almost 15 of those cases ending in deaths. In contrast, Bel Air only had 65 coronavirus cases, with no deaths recorded. All this, despite the fact that as a relatively young population, other things being equal, Latinos should have had far lower infections, hospitalizations, and death rates than other Americans. But we know other things aren't equal. Our low insurance rates and poorer health outcomes are deeply systemic. We're more likely to suffer from chronic conditions like diabetes and obesity. And this isn't something inherent in our culture. Where we live, where we work, and our socioeconomic status, all areas with disproportionate effects in our community, influence our health. Let's expose the structurally racist roots of health insurance policies. The employment-based insurance system we have in the US is implicitly racist, in part due to unequal access to education and employment discrimination. Latinos are concentrated in the service industry, where employers do not offer health benefits. Only about 41% of Latinos receive health insurance through their jobs, compared to 66% of white people. Meanwhile, because the IRS decided that health insurance premiums paid by employers were tax exempt, people who have employer-based insurance receive an annual $260 billion tax subsidy. While government programs exist to help close this gap, many people in our immigrant community remain ineligible to receive health insurance. And even when we do have health benefits, things like language barriers can have devastating consequences. You might be surprised to hear that bilingual medical services and documents are not always guaranteed. So the fight continues because our community deserves equal access to good quality healthcare.